Before schools reopened in September, there was a fair bit of apprehension that the decision may lead to a spike in COVID-19 cases. In our weekly Q&A with Toronto's Associate Medical Officer of Health, a viewer asked whether schools are contributing to COVID-19 case numbers in a significant way like they seemed to do last year.
The school question is a very interesting question. We've actually now had schools open for well over a month, many weeks now, and we've actually seen that the case rates have actually stayed about the same, maybe even had a slight decrease. What we're very well aware of is that it's community transmission that often drives school cases. That's usually how students bring COVID into the school. It doesn't always spread in the school setting. So every person who has been at school while they were contagious does not always end up spreading it in the school. And that's because of all of, the masking and the cohorting that goes on in the school setting. So we're actually seeing an effect from the vaccinations affecting the community rates and likewise affecting the school rates. Now, this is something to keep a very close eye on, as we get colder into the months, as we go indoors, and to see the effects of school on our rates in general as well.
If we see exponential spread in schools, does TPH have the authority to shut them down again?
Okay, so, schools have been open again for many weeks. We haven't seen exponential growth, but again, what we're likely to see is first exponential growth in the community before we see it in schools first. That is the pattern that we've had, but we're looking at both metrics as well. Absolutely, when there is a case in a school, we do case and contact management. If there's an outbreak, we do outbreak management. Can recommend that schools be closed, can order that schools be closed if required. We work very closely with our school boards to, again, assess COVID and to keep COVID risks low in the school setting. But we don't always know what the future holds, but we will certainly act. Mm-hmm. Public health will act to prevent the spread in the future.
If you missed this Q&A on our website and YouTube, you can catch the next one coming up next week. To submit your questions for that, you can go to our website, toronto.citynews.ca/COVID answers. For City News, I'm Dilshad Burman.